Welcome to CMM Off the Page, a podcast brought to you by CMM Magazine, a brand of Care Choices Limited. Guest speakers will equip listeners with take-home advice to support best practice in the social care sector. The podcast is available to listen to on Spotify, Apple Podcasts, and to watch on the CMM website. We hope you enjoy this latest episode.
Hempsons are delighted to be involved in this latest edition of CMM's Off the Page podcast. My name's Philippa Doyle. I'm a partner and head of social care at Hempsons. We're a national firm of solicitors supporting providers across the social care, health and charitable sector. I'm particularly delighted to be involved in this podcast today, analysing all things CQC, but in particular looking at the new single assessment framework. And I'm also particularly delighted to be able to launch the new toolkit that we have created in conjunction with Care England, aimed at social care providers. Its purpose is to demystify the single assessment framework. It breaks apart each quality statement, builds it back together again, telling you as a provider exactly what you need to know and how to present your evidence to hopefully score maximum points in response to each of the quality statements. The podcast is a great listen, really interesting conversation between myself, Martin Green, and Sharon Lowrie, Chief Executive of Be Caring, a domiciliary care provider in the north of England. So please do have a listen. I hope you find it of interest, and I hope the toolkit will be worthwhile for your service.
Hello and welcome to the latest episode of CMM Off the Page, a provider-led podcast discussing the latest issues impacting the adult social care sector. My name is Henry Thornton, lead editor at Care Management Matters, and in this episode, I'll be taking us through proceedings as we discuss everything you need to know about the Care Quality Commission's single assessment framework. Joining the conversation today, we have a selection of leading sector voices who are all well placed to provide insightful commentary and analysis on all things single assessment framework. Now seems like a good time for some introductions, I think. Beginning with you, please, Martin, who's also my co-host for today's episode.
Thanks very much, Henry. I'm Martin Green and I'm the Chief Executive of Care England, and we're a provider organisation and we represent a significant part of the sector. Our members manage and deliver services to older people, people with learning disabilities and autism. We have some brain injury units and also some mental health units. So I hope that we're well acquainted with the big issues in the sector. And of course, one of the biggest issues is the one of regulation. And that's why today's podcast, I think, will be really helpful to the sector.
Thank you. And Sharon?
Oh, hi everybody. My name's Sharon Lowrie. I'm the Chief Executive of Be Caring. We're an employee-owned organisation based in the north of England, supporting older people to live in their own homes and supporting people with learning disabilities. We're an employee-owned organisation, so very much about valuing our care workers and empowering them and supporting them to do the very best for the people they support.
Thank you. And Philippa?
Good morning, Henry. Thank you for inviting me to be part of this podcast. My name's Philippa Doyle. I'm a solicitor and partner at Hempsons. I head up our social care team. I've had the pleasure of working with Sharon and Martin for a number of years now. I'm delighted to be part of this morning's discussion. We specialise in providing advice to the social care, health and charitable sectors. And over the last 10 years, my particular areas of expertise have been CQC. So I've worked with any number of providers, from small 5-bedded residential only care homes right up to big teaching hospitals and everybody else in between that is the subject of regulation and inspection by CQC. And so the insight that I get from the way that they approach hospital inspections compared to the way they approach social care inspections is really useful to be able to kind of feed top tips, hints and advice and guidance across all of the different sectors, because the regulations are exactly the same. Regardless of the service that is being delivered. But obviously the approach that CQC take to that inspection can vary quite wildly, both up and down the country, but also depending on the service that's being assessed, as the new phrasing is now, rather than inspected.
Thank you, Philippa, and thank you, everyone. Let's get into it, shall we? Coming to you first again, Martin, perhaps you could briefly set the scene about the single assessment framework, providing some context and why it's been introduced.
Well, I think the single assessment framework was really an attempt to make sure that there was a bit of consistency across all the services which CQC regulated. So the idea behind it was to have one single assessment approach, and regardless of whether or not you might be in social care or healthcare, whether you're in the community or whether you're in residential or indeed in acute services, there would be one framework within which everybody would be judged. I think that sounds like a really good idea. It was also supposed to be underpinned by a really clear approach to having some very clear evidence categories and an ability for care providers to be able to upload some of those evidence bases through a new IT portal. So the whole approach was to improve consistency, to deliver a unified approach to regulation, so we were all supposedly working from the same space, making the system much more efficient through the advent of this portal. It was also, I think, designed to use the staff that CQC had more effectively, so that they would be able to cover more in terms of the number of services that they assessed. So I think those were the ideas behind it. I'm sure later on in this podcast we'll get onto the reality, but I think that was my view about why they decided to go down that road.
Thank you, Martin. Philippa, could you provide an overview of some of the key differences with the new framework in terms of shifting from key lines of inquiry to quality statements and I statements?
Absolutely. I want to kind of echo Martin's positivity as well around, you know, the thought process behind the new single assessment framework. I have always thought, right from when it was first launched, and I still think now that it has the potential to be an excellent tool, and it has the potential to work really, really well for providers. But the key principles underpinning it, and in particular the resources in terms of the IT and the personnel to make it happen, are the two key bits I think that are just not quite fit for purpose, which is why it's stumbling at the moment. But the key differences was previously you had 303 key lines of inquiry, which were basically questions for an inspector to pose to a provider. And they might pose them as asking that exact question for a provider to give an answer to it, or they might in their own way work out in their heads based on what a provider is saying to them or what evidence a provider is showing to them, an answer to that question without actually asking the question. And you never really got in your report a true response to that question, to that key line of inquiry. What you got was a report that used to make quite a lot of sweeping statements. Sometimes one of my real bugbears was CQC always used to say, some people told us that, and that might refer to one person saying something, or it might refer to 500 people saying something, but you could never really gauge what level of interaction there had been to give that report. So there was a lot of what was often perceived as fluff, and a lack of clarity. And sometimes if you got an inspector that was focusing on one particular area, the report that you got might not really be a true reflection of the totality of the service that was being delivered on the ground. And the biggest issue was that once you'd got your rating, that was it. You know, there was pre-COVID, there was a very rigid timetable of, you know, if you were outstanding, they wouldn't come back for 3 years. If you were good, it would be 2 years. If you were requires improvement, it would be a year. But the reality was that the resources weren't in place even then for them to come back with that degree of regularity. So if you did have a provider who was assessed as being requires improvement, and they did an awful lot of work over a 6 to 12 month period, they would almost be fighting for CQC to come back to say, look, we've done all of this work, you know, we're really good now, come back and see us, come back and reassess us. And you just couldn't make that happen. So there are thousands of social care providers out there who are languishing with a rating that just doesn't reflect the service that they're being they're delivering. And so the whole idea of the new approach is that, it's broken down into these 34 quality statements. Points mean prizes. So, you got clarity on exactly what point scoring you were getting in response to each of these 34 statements. And so if you dipped really badly in one of those, say your infection prevention control was all over the place on the day that the inspector came in, and she's scoring you a 1 on that because it's really, really bad. You can go away as a service, do a piece of work, sort out that particular problem, upload your evidence to CQC to say, look, we've sorted this policy, we've sorted this procedure, we've got all of these documents in place, and here's some evidence about how it's working on the ground. And CQC could look at that and say, oh, yeah, brilliant, no problem, you've sorted that out. We're going to lift that 1 up to a 2 or possibly even a 3. And that might change the whole rating of your service or the rating of that particular domain. And the idea was that would happen quite swiftly. So in a matter of 3, 4, 5 months, you could maybe get the rating of your service changed, which from a provider's point of view and from the public's point of view, they can see what work has gone into that and they can see how it's changed. So as a concept, I think it's absolutely brilliant because it gives providers and it gives the public all of that level of information that is really new and really, really current and up to date. It's not from 3, 4, 5, 6 years ago. But as I say, it's stumbling because the IT isn't there to be able to do that, and the people aren't there who with the right level of training to properly understand what's going on and what the significance is within a service.
Yeah, thank you so much, Philippa. And Sharon, what was your organisation's reaction to the rollout of the framework? How has your organisation embraced the different principles of the new regime?
Yeah, thanks, Henry. I think I totally echo what Martin and Philippa have said. I think the principle is spot on. I think the application's probably been somewhat iffy. What we did, we concentrated on evidence. So the last sort of, well, I'd say a few years, we've built up a bank of evidence around all of the quality statements from the people we support, from the partners we work with, from our colleagues. One of the inspectors said to us when she came, because we were inspected in June, and do you know what? It was a brilliant day. It didn't feel very different to a normal inspection, but she did make it clear, look, it's not about, I can't see something or hear something. I've got to have a physical piece of evidence to put into a file, which will contribute to the score. So actually, we thought, brilliant, we've got evidence galore. So that was one of the key bits we did. I think we missed a trick in terms of breaking that evidence down and saying which piece of evidence aligned with which quality statement. So I think we may have overfaced them. And in going back to Philippa's point, actually they don't have the resources to wade through 250 pieces of evidence and decide which quality statement it fits into. So it was a huge learning curve, but I think fundamentally the foundations are there for it to be a strong quality monitoring tool.
And Sharon and I talked at the time after her inspection, because we've worked together for a long time, that actually responding to the single assessment framework is a bit like going back to school, and when the teachers used to prepare you for an exam. And they used to say to you, don't just write everything that you know about the subject, make sure you read the question and make sure you answer the question that's being asked. And so certainly what I say to providers is that you might have a piece of evidence, and you might need to use that piece of evidence 5 times in response to different quality statements. And so you're going to need to upload that piece of evidence 5 times, because you need to upload your evidence in response to question 1 and upload your evidence in response to question 6, and then in response to question 32, because that's how CQC will look at it, because that's how the computer system is set up to look at it. So it's very much like that old Catherine Tate phrase of computer says no. It's very, my understanding is it's very box driven. And as Sharon's just said about her inspector that came into the service, I've got to have something to put in each individual box. So don't just give them 250 pieces of evidence and expect them to sort it out, because they'll just go, meh, not interested.
For providers grappling with that, what some best practice strategies for gathering that evidence? What does that gathering evidence process look like? What should some priorities be for those providers?
So when you look at the individual quality statements, CQC have very helpfully said which evidence categories will apply to each quality statement. So you can look, and providers should drill down into each quality statement and do them one at a time to say, right, well, they're looking for policies and procedures there. If we look at sort of quality statement 1, it's all about learning and development. So they're looking to see, how have you managed incidents? So they'll want to see what your policies and procedures are generally around incident management, and then they'll want to see specific examples of when there was an incident. How did you document it? How did you follow up on the management of that incident? How did you feed back and report back to the family, to the person, to staff? How have you changed the organisation? So there's kind of a whole thread there of different pieces of evidence that you as a provider ought to have within your organisation, that you can then demonstrate to CQC, kind of beginning to end, theory, an actual issue, and then how you've learned and changed the service as a response to that. So it might also, in that example, if it was a notifiable patient safety incident that generated a duty of candour investigation, CQC will be looking at your duty of candour policy and specifically the process that you followed, and then was there that concluding letter at the end. So when you break it down, and when you sort of properly drill down into each of the individual quality statements, there is an awful lot of information there that tells providers what to do, but you've got to make the time almost to sit down and pull it apart and do it. You can't just expect it all to sort of fall into your lap and for CQC to do that job for you when the inspector comes saying, well, I want to see this and I want to see this and I want to see this. Because my feeling is that they're not doing that anymore. They're expecting you as the provider to have done the front end of the work.
Just to add to that, I don't know whether I should confess this or not, but I had an action about sort of maybe 6 to 9 months ago to actually do that piece of work Philippa said. And I think when you look at 34 quality statements and all the subcategories and all the headings, it can be a bit overwhelming. And so subsequently we had all the evidence, but it wasn't organised, So I think if there was one tip I would give to providers is take it bit by bit, focus on safe, focus on well-led, take each quality statement and see what evidence you've got. Have you got your processes and your systems and your governance in place? Have you then got evidence of how you followed all of that through? This is not going to be quick, and it's probably going to take a good sort of 6 to 12 months for you to gather all of your evidence, but do it over a period of time. Hope that helps.
Sharon, I think that's a really good point, and I think also providers should think about how they see things that are happening in their service and then identify, well, that might be useful as evidence when we get an inspection or when the inspector calls. So it's about setting up systems so that as you deliver your services and as you learn from experience, you can put that into an evidence bank so that when you're required to give that evidence, you can then draw down on it much more easily. Because the challenge is that often we're asked for this evidence in really short time frames, and then we have to scrabble around for it. So setting up systems from the get-go and identifying when things happen, oh, that might be useful in evidence when we have the inspection, just putting it into that system is a really good way forward, I think.
Yeah, I would echo that, Martin. And I think those services out there who have already been rated outstanding are the ones that did that exercise with the old key lines of inquiry as well. They worked through each one of those 303 key lines of inquiry and thought about, what their answer was to that question and had the evidence ready. And that's certainly what I'm recommending providers do. Is almost I talk a lot anyway about having action plans. CQC love an action plan. They love an action plan that identifies deficiencies, and then they love seeing you having fixed that deficiency and signed off the action plan. So you can almost use the quality statements as an action plan. You know, pick 2 or 3 a month and say, right, in October, we're going to focus on these 3. We're going to look at what we've got, look at what we need, look at what improvements we can make. And if you give yourself, you know, as you said, break it down into bite-sized chunks and do it in quite a short timetable. You know, we all know that if you've got a massive long list and you don't put an end date on it, you never get through the list. But if you've got a really short list with a really short time frame on it, you can get things ticked off that list and you can work through it. So you can almost show CQC as part of your overall learning and development. So answering that question 1 and your governance and how well led you are, that you're working through the quality statements as part of the evidence of the learning and development of the organisation. So it almost comes full circle, and rather than becoming an onerous task, it becomes a tool to drive improvement.
So perhaps, Martin, you could touch upon how Care England's membership has responded to the shortcomings of the framework during its implementation.
Well, I think we shouldn't be anything other than blunt about this. The implementation of this has been absolutely disgraceful. There has been no proper plan. It's really interesting because providers often say to me, oh, I don't really understand this framework. Well, partly it's because neither do inspectors. There was no systematic approach to getting the inspectors up to speed on how they were going to work. So on every level, this has failed. I also am very interested in the things that Philippa said about getting together an action plan. Well, CQC need to give us an action plan. I felt that what they delivered to us last week was nothing more than an insult. If they received that as an action plan from a care provider that they regarded as inadequate, they would have literally thrown it back at them. There were no key milestones. There were no key dates on which they were going to deliver. We should also remind ourselves that this has had a gestation period longer than 15 elephants. They have been working on this for literally years and they failed miserably. Now there needs to be, first of all, they gave their apology, but their apology needs to be backed by a clear action plan. They need to tell us how they're going to dig themselves out of this hole, just as they would expect any inadequate service to tell them that. There were clearly failures in the operational management, but there were also failures of leadership in that organisation. There were things that they were failing on that they expect care providers to succeed on. And I think there has to be some accountability. And I want to give this public commitment that I want to work with that person to dig themselves out of this hole, because I believe we've got to have good quality regulation. And if we get it right, it's the cornerstone of public protection, but it's also a mechanism for sector improvement. And Philippa, you very graphically told us how it could be used as a sector improvement mechanism. So I am absolutely a believer in regulation. But what I'm not going to do is tolerate the performance of this regulator. Now, on their own admission, this regulator has not performed properly, and they've apologised for that. Well, in the normal course of the events, that would deliver a refund on people's fees. An inadequate service is being delivered, and yet care providers are paying a fortune for that inadequate service. If I go and buy an iron in John Lewis and it doesn't work, I get my money back. Well, somebody needs to address that issue. And the notion of re-establishing trust, which they talk endlessly about, well, that can only be done with some tangible things that they need to do to prove to all our sectors, because this isn't only about social care, it's about health, that they are actually taking seriously their re-establishment of trust. And they're also acknowledging their failures. They're attributing accountability for those failures, and they're moving on from them. But they can't expect us to just think that they're going to say, oh, we're really sorry, give us another 3 years to get our act together. That does not, play well with anybody. They haven't got any time left because they've wasted so much of it. They haven't got any money, they tell us. Well, frankly, they've had lots from us. I have members who are paying well in excess of £1 million for a service that they've identified as being inadequate. That cannot continue. So the new chief executive needs to come in with a very clear plan. And if he does that, and also if he shows where the accountability for the failures lie and deals with that, then I know the sector will stand behind him and will support him to turn around this to become a functioning regulator.
Thank you, Martin. I think that's exactly what the sector wants. It cannot function without an effective regulator, and as you said, everyone stands ready to support that that manifestation. Just picking up on the statement made by the regulator last week, Philippa, I was hoping you could provide an overview of how the CQC has introduced immediate changes to the framework since its original implementation.
The only real thing that I picked up out of, as Martin described it, the inadequate action plan, was that they have changed the scoring system ever so slightly. So when Sharon and I were talking about the different types of evidence that you have to produce, the original proposal was that each piece of evidence would be assessed and given a score between 1 and 4. So 1 being inadequate, 4 being outstanding. And then each piece of evidence would then be filtered into the overall score for the quality statement. So each quality statement would then be scored from 1 to 4 based on the scoring of the evidence that would be converted into a percentage. And then depending on how many quality statements there were in each domain, so if we take SAFE that's got 8 quality statements in it, your overall percentage then in response to those 8 questions would then determine the percentage score, and the percentage score would then determine your rating. So I think the figure is it 62 or 63% is a good. So if overall across your 8 quality statements in SAFE, you were able to get over that benchmark, then you're going to get a good rating for that service. So it was almost too complicated because it was assessing the minutiae of each individual piece of evidence. And so my understanding is that the scoring of the evidence has now gone. And what they are now focusing on is the scoring of the quality statement. So a little bit like you could have 2 patients in a hospital beds side by side with the same diagnosis but very different presentation. You can have 2 services providing a whole range of evidence in response to one particular quality statement, and it might be very, very different evidence that's provided by those 2 services, but it's not the evidence that's being judged and scored, it's the quality statement that is being scored. So different evidence and different types of evidence and almost different quality of evidence might still produce the same scoring. So it sounds complicated, but actually I think it's much easier because it's stripping out a level of bureaucracy almost in having to judge each individual piece of evidence, and it's just looking overall collectively at the evidence that is being provided in response to this one statement.
Thank you, Philippa. Sharon, perhaps you could provide any reflections on frustrations your organisation experienced with the implementation of the framework, and whether you believe that the statement released last week will be effective in overcoming those.
Take on the statement from last week is that it probably won't change much for providers. So they'll still, and I think it's quite a good tool for providers to ensure they've got sufficient evidence across all the relevant categories to present back. What I'm hoping it will do is, rather than CQC focusing on the minutiae of the evidence, they'll be able to judge it in its entirety and make the narrative within the report more personable to the service being delivered. So I'll be honest with you, when we received our report, we didn't really recognise the service. They were very bland statements. And I'm slightly obsessed with reading CQC reports, and the amount that I've just got 75%, you know, so it's not really doing what it set out to achieve. It's not giving any incentive for good providers who do go above and beyond for that to be recognised. So I'm hoping that it actually frees up some capacity and some time within CQC to apply a more reasonable approach, rather than what feels like a bit of a AI generated score and narrative which doesn't reflect the service. So I don't think it changes much for providers. I would probably still recommend they look at those different evidence categories and make sure they've captured as much as they can. I'm hoping it frees capacity up for CQC to strengthen what they're doing, because it's not working.
Just to come to you, Martin, but what else needs to be done then to make sure that the framework does work, is effective?
Well, I think the first thing they need to do is get their inspectors up to speed on what it means and what the evidence categories are and what the levels of evidence required are. And one of the challenges in all this is that you have situations where inspectors don't understand the new system. You also have situations where inspectors go into services that they've never been into before to pass judgment upon them. So I think they've got to really look at how they get their inspectors up to speed on it. I was also interested in what Sharon said about some of the reports. One of the other things that I've noted as a recurrent theme is that you have an inspection, you have the verbal feedback from the inspector, which says, oh, it's all going very well. And then, months later, you get the report on the mat, which seems to bear no resemblance either to what was said during the inspection or indeed in the verbal feedback. There is also an issue of timing. They need to get much better at delivering the reports in appropriate timeframes. Interesting to talk about the level of culture change needed at the CQC. One of my members had an inspection, and it was a very long inspection, 3 days, and they provided loads and loads of evidence. And at 7:29 on the Friday night, they were sent a list of over 20 things, and they were told, and this must be ready for 9 a.m. on Monday morning. So they worked really hard and they got all that evidence together, and they waited months, and I mean months, for the report. So if, for example, they're saying, give us this data and do it over 2 days at a weekend, I think it's not unreasonable if, when you have an inspection, you send an email to the inspector saying, I want that report on my desk by a week on Wednesday. That would be an appropriate way to behave. So I think, there are issues about the performance of the regulator. There are issues about how they've trained their staff. There are issues about culture. And when they address all those issues, I think we'll probably have a functioning single assessment framework, which will be then helpful to people who use services. And I think one of the things we should also really underline is that this is failing people at their most vulnerable. It's failing families who might be looking for a good care home for somebody they love who's had a stroke and can no longer go home. It might be failing families who are looking for somewhere for the young person that they love to go into a learning disability and autism service. It may be, failing people who are desperate to get community support in their own homes, but don't find that the inspectorate's judgment is useful to them in making those decisions. Well, the whole point of inspection and regulation is about giving clear signals to the general public about what services are the best and how they should then choose services. And I think, there's been a lot of talk about providers, there's been a lot of talk about CQC, too much talk about CQC actually, and we need to focus what inspection is for, and it's for people who use and need services, and it helps them to make informed choices. And the people we are failing first are the people who are our citizens, who have a right to expect regulation helps them to get a good service. And at the moment, they're not getting regulation that does that.
I think I'd echo that as well, Henry, and it very much feeds into the experience that Sharon and I have had very recently of a very, very bland report that's got no colour in it, does not assist a family in making a decision as to whether to use Sharon's service or whether to use, a neighbouring one down the road. It needs to have some life in it. It needs to have some colour in it, to be a proper description of the service that's being delivered. And certainly one of the other experiences that we've had is the inspector not being involved in the drafting of the report. The inspector, go as Martin has said, gives feedback on the service, and it might be, fabulous feedback, and then they're feeding that back into an assessor who has never set foot inside that service, knows nothing about them other than the documents that are being presented to them, which they're then just uploading into a system. And we have no way of knowing whether it is an AI generated program that is then producing those reports and looking at all the information, or whether there is an actual person who has seen that service, who has spoken to the people who are receiving those services, who've spoken to the staff working in the service, who's been properly involved in the development of that report. So part of me almost wants to go back to the olden days of, when it was the responsibility of the inspector to write the report, because they were the ones who had, to use CQC's phrase, crossed the threshold. They'd been in the service, they'd seen it. So even if they were sometimes blinkered or, too focused or too narrowly focused on one particular area, at least you knew that they were writing about a service that they'd been into and that they'd spoken to people, rather than it being an anonymous person behind a computer or even the computer itself.
Yeah, I think it sounds too like it's too simplistic, but I think given the experiences that everyone's had, then perhaps it is, in part a common sense approach that the regulator needs to apply.
I think there'll be lots of parts of the process that it's absolutely right that there is a standardized computer system that says, does this policy, it can scan a policy and it can see whether all the key elements of that policy are in place. But just having a policy, just having a suite of documents that, look wonderful on a shelf or look wonderful on somebody's intranet, is only 5% of the story, because you can have a wonderful suite of policies, but if nobody's living and breathing those policies and using them, then you might as well not bother. And the computer can only say whether the policies are there. They can't say whether they're being properly implemented. Only a physical person can do that.
Absolutely, and the sector is not one, I think, that benefits from automation. It needs people, it needs people's experiences, it needs people's authentic experiences of care setting, of people that work in that setting. I think automation can only get you so far in this sector.
And that's where you get a real divergence of approach as well. That obviously the vast majority of the people that we're supporting in the social care sector, we're doing that 24/7, or certainly for significant periods of time throughout that person's life, for months or years in some cases. Whereas the exact same approach is being used to assess GPs, where you see somebody if you're lucky for 6 minutes, or a hospital setting where you might be in A&E for 2 hours if you're lucky, or 24 hours sometimes. It's a very much a snapshot in time, covering a lot of people, whereas in social care it's a much longer period of time to look at how one person is being supported. So again, it's having this standardized system which actually doesn't quite work across the sector, because the spectrum of health and social care is so different from end to end.
I think a key message to CQC is you've got some amazing people working within the organisation. I think it comes back to Martin's point. They are a bit disillusioned. So I've talked to many inspectors who are frustrated, and particularly not being involved in that actual assessment, that final narrative, writing about the service that they've actually been and seen. So there's a missed opportunity there. They've got to get the inspector involved in that final assessment piece. That would be my plea.
So we've covered a lot of ground in a relatively short amount of time. So for providers that will undoubtedly have questions, queries regarding the single assessment framework, a new tool has been launched by Care England with Hempsons to demystify the single assessment framework. So I was wondering if we could discuss that tool and how it will benefit providers who have questions about the framework.
Well, one of the things to say is that we had some fantastic webinars which Philippa led, and Philippa's got so much in-depth knowledge, and there was a real appetite from care providers to attend those seminars. But of course, there are only so many people who can attend webinars and seminars. So what we thought we would do, and certainly because of some of the things that came up in those webinars, there was a real appetite for some kind of toolkit that would really help providers to understand the intricacies of the new system and how to navigate it. And Philippa has been amazing in the way in which she has really been at the side of providers, helping them to navigate through this difficult time. And so we thought it would be a really good thing to partner together to develop with Hempsons this toolkit. Philippa, I don't know if you want to add anything to that.
Thank you, Martin. Yeah. It was one client who came to me to start with and said, you know, can you do a piece of work? Can you pull all of this apart and put it back together again for us effectively? And certainly the webinars that I've done and individual training sessions that I've done, I did one with Sharon and her service right back at the beginning of the year, where we were all still, you know, pulling it apart and trying to find our feet. There's actually an awful lot of information out there on CQC's website about what they are looking for from services, but information will go on the website and then it will disappear, or it'll reappear on the website in a slightly different way. And as a provider, it's very time consuming to kind of sit there and do that piece of work to work out, well, what are they saying I need, and what do I need to do in relation to this, and what do I need to do in relation to that? So I have sat there and tried to bring together into one place as much of that evidence and information as I can to give providers the tools to look at their own service. So CQC give us each individual quality statement. There was then a document that they produced earlier in the year that told us what that quality statement actually meant. So when you think about those original 303 key lines of inquiry going down into 34 quality statements, actually each quality statement is sometimes made up of 4 or 5 different parts. So it's not that they've got rid of 200 and something questions, they've just merged them all together. So I've pulled apart the quality statement, broken it down into the bullet points of what CQC say they're looking for within that statement. They then helpfully told us which evidence categories they were going to focus on, whether that was processes, policies, documentation, whether it was feedback from the person that's being supported or their family, or feedback from staff, or feedback from commissioners. And then I've looked at the regulations that underpin the single assessment framework, because the fundamental standards of care, the regulations that all providers operate against, have not changed. They are still exactly the same as they were before. So I've looked at which regulations are relevant to each quality statement and what key areas I believe a provider needs to focus on, and the things where there has often been criticism of a wide range of services, and things that a service needs to ensure that they have in place to be able to demonstrate that they understand the requirements of that quality statement, and they can hopefully get that 3 or 4 point scoring to get good or outstanding. So as the toolkit effectively operates along the lines of what I suggested earlier in this discussion, of you could say, right, let's focus on SAFE this month. Let's look at the quality statements in SAFE. This toolkit will then enable us to look at each quality statement one at a time, look at what CQC say we need, look at what regulations are relevant, so that we can then say, right, have we got all of the evidence in place, or is there something that we need to create, or something that we need to find, or something that we need to do differently within our service to ensure that we've got everything that we think that CQC are looking for in response to that quality statement. So rather than just having a bland statement and kind of picking your way through the dark and trying to work out what we might need to provide in response to that statement, the toolkit it doesn't quite give you a list or a checklist, but it gives you some very clear steers and very clear pointers as to what you need to focus on within your service. So because every service is so different, and because a dom care service supporting somebody at home is going to be very different to a care home or a mental health service, I shied away from giving people a checklist because the checklist would be different for every service. But what I have done is break it down into almost words of one syllable or less, so that everybody can say, right, okay, let's look at this question. Have we got everything that we need to be able to answer this question? And can we then also store it on one place in our computer system? And can we be continually adding to it so that at the point when CQC do come calling, we've got all of the information ready to upload straight away in response to that one quality statement.
Thank you, Philippa. That sounds like an extremely useful tool, and I think will be certainly well received by the sector. So that is really wonderful to hear that has been issued now. Any final reflections on today's conversation before we bring this episode to an end?
The only final thing from me is that whatever we may think about them, I can't see CQC going anywhere anytime soon. They're here to stay in some way, shape or form. They've come too far with the single assessment framework to rewind and go back to the old process. So for providers now who are delivering care now, they could still potentially come calling tomorrow. And so you still need to work your way through this process, and you still need to be prepared for them. And hopefully Martin will be able to bang some heads together and make some changes at the top table that will then filter down for the benefit of providers. But from my point of view, I still want to help the sector in terms of where they are now, and help you to showcase your service and present yourselves in the best possible light. Because as I say, there's fantastic work going on out there. The thing that I see most from providers is they're just not great at shouting about it. And so that's why they're not getting the best scores, because they're not presenting their evidence in the best possible way. So I hope the toolkit and the training that I can do alongside that as well will be helpful for people.
Well, I would agree with that, Philippa. They're not going anywhere. We have got to try and whip them into shape. But what I would say to providers is be proactive, be on the front foot, have as much information as you can get about what the evidence categories are, how you might show from your work that you are delivering for people, so that when the inspector calls, and you're right, Philippa, they will call at some point, you are ready, rather than having to scrabble around and try and get evidence. It's all there ready. You understand what evidence categories that you can align with what particular pieces of evidence. So I think proactivity and also seeing this as something that is part of normal work rather than waiting for the inspector to arrive is probably my best advice.
A huge thank you again to Martin, Philippa and Sharon for your time and invaluable contributions to today's episode. This has been CMM Off the Page podcast, discussing everything you need to know about the Care Quality Commission's single assessment framework. If you like what you've heard today, you can catch up with all previous episodes on the CMM website, Spotify or Apple Podcasts. Simply search CMM Off the Page in your browser. Thanks everyone and take care. Thank you for tuning in to CMM Off the Page. Explore CMM's portfolio of content, including daily news, blogs, a magazine, and CMM Insight webinars by visiting www.caremanagementmatters.co.uk. To make sure you don't miss a podcast, follow CMM on Twitter @CMM_magazine and use the hashtag CMMOffThePage to join the conversation and share your feedback. See you next time. CMM Off the Page. Listen, learn, lead.